Hey guys, Lance here with Medicare Advisors, and we are a team of friendly licensed agents dedicated to helping seniors navigate the complex world of Medicare. So today I'm going to discuss how much Medicare costs, but before I start, please remember the information I'm sharing is just for your general knowledge. If you really want to maximize your Medicare benefits by getting the best coverage for the lowest amount possible, call our toll-free number at 1-800-240-5241 between 8 a.m. and 6 p.m. Eastern Standard Time Zone. The number will be displayed on the bottom left throughout the video for your convenience. Okay, so let's get started with today's topic. If you're asking yourself, how much does Medicare cost? Do you have to pay for Medicare? Is Medicare Part B free? And what will be my Medicare premiums? Then you're asking very common questions about the costs for Medicare. The costs for Medicare Part B and Part D, as well as supplemental coverage, are something that a lot of people don't anticipate. It can surprise you when you turn 65 and learn that Medicare isn't free. So, do you have to pay for Medicare? Well, yes, most people do pay Medicare premiums. Fortunately, it's fairly easy to put together a Medicare cost estimate so that you can plan ahead. But let me start with Medicare costs for Part A. The cost for Medicare Part A for most people is usually zero. If you've worked 10 plus years, 40 quarters in the US, you have already paid for Part A via payroll taxes because 90% of beneficiaries qualify for free Part A. Now, if you have to buy Part A, the cost for Medicare Part A will be around $471 a month. People with less than 40 quarters work experience, but more than 30 quarters, can get a prorated premium of $259 a month. Now, to be eligible to buy Part A, you must have been a legal resident or have had a green card for at least 5 years. Now, should you have a hospital stay, your Part A deductible will be $1,484 in 2021, and this is an increase of $76 from the Part A deductible in 2020, which was $1,408. However, if you have a Medigap plan, it will likely cover this cost for you. Now, next up is Medicare cost for Part B. Medicare Part B premiums are based upon your modified adjusted household gross income. The Social Security office will pull your IRS tax return from 2 years prior. They use that tax return to determine what you'll pay for Parts B and D. Part D premiums are also based on income. The items that contribute to your modified adjusted gross income include any money earned through wages, interest, dividends from investments, and capital gains. It also includes Social Security benefits and tax-deferred pensions, distributions from Roth IRAs and Roth 401ks. Life insurance, reverse mortgages, and health savings accounts do not count in the MIGA or MAGI calculation. If you filed jointly with a spouse, Social Security will base your premiums for each of you based on that married income. However, you will each pay your own Part B premium. Your premiums for Part B are always individual, not combined. Social Security simply uses your household income to determine where you fall individually in the Part B premiums chart. Social Security will usually notify you of your next year's premium annually in December or early January by mail. Only about 5% of all Medicare beneficiaries currently pay higher Medicare premiums. And lastly is the Medicare cost for Part D. Just like Part B, your Medicare cost for Part D varies based on income. Your Medicare Part D premiums also vary by plan. Each state may have 20 or more plans to choose from. You can find plans that start around $10 to $15 per month in most states. Whatever the premium is for your plan, that is known as the base premium for Part D. You will pay the plan's published base premium unless you're in a higher income bracket. Now, people with higher incomes pay more for Part D. It's important to factor this in if you are comparing the potential cost for Medicare Part D against other insurance, such as employer insurance. So if you're getting ready to enroll in Medicare for the first time, or if you're already enrolled in Medicare, one of the most important things you can do is review all your options as Medicare plans and benefits are updating and changing each year. Now, if you're enrolling for the first time, it can be very confusing trying to figure out which plan will be right for you. And if you're already enrolled, it's a good idea to review your coverage each year because you could be missing out on some important benefits offered by the major providers in your state. By reviewing your coverage, you may be able to upgrade your benefits without having to pay more money. But in either situation, this can be confusing to try and figure out all these things on your own. So fortunately, there is a very simple way to get the most recent benefits without having to call several insurance companies or even spend endless amounts of time scrolling through the internet. There is a completely free, no obligation helpline to give those enrolling in Medicare for the first time or those already enrolled in Medicare the information they need to take advantage of all the most recent benefits available to them. So if you're wondering about how to sign up for Medicare and finding the right plan for you, or if you're worried you don't fully understand your current Medicare plan, or maybe you're just curious about other types of benefits you could get at no extra cost. Either way, you can go ahead and call this toll-free number, 1-800-240-5241, which you can see on the bottom left of the screen. We are open Monday through Saturday, 8 a.m. till 6 p.m. Eastern Standard Time. Then once you call, you'll get the chance to speak with someone who will be happy to answer any questions you might have and find you the best coverage available for you and your particular situation. And even if it's outside the annual enrollment period, it's still very easy to switch your plan if you'd like to do so. Also, if you have any questions you'd like to post down in the comment section below, we love getting to answer as many of those as we can. But otherwise, I hope this video was helpful, and I'll look forward to seeing you in the next video.